Well, the House Republican health care plan to repeal and replace Obamacare has been out there for over a day now, and now it's up to the Republicans and the White House to sell it to the public. So here to answer a few questions on the new plan, the Vice President of the United States, Mike Pence. Thank you very much, sir, for joining us this afternoon.
Thank you.
Well, let me ask you, the Affordable Care Act covered about 20 million people, but the American Medical Association suggests millions will lose coverage under the GOP plan. Will they?
I don't believe that's the case. The truth of the matter is that Obamacare has worked a great hardship on American families and on the American economy. You've literally seen premiums since Obamacare was passed increased by as much as 100%, an average increase in premiums last year alone of 25%. People have lost their doctor, they've lost their coverage. Obamacare has failed, and the legislation that was introduced in the Congress today is the beginning of President Trump's commitment to keep a promise he made to the American people to repeal and replace Obamacare. We'll repeal this failed policy, but at the same time, we're going to replace it with a program that'll give Americans more choices in health care, give states like yours the ability to even do a better job and have more flexibility serving the needs of your most vulnerable in Medicaid.
So let me ask you about that.
We're very encouraged by the support we're receiving, and we're confident we're going to be able to come out at the end of this process with a better health insurance system and a better health care economy for every American.
Well, let me ask you about that. The early breakdown on winners and losers in the GOP plan suggests younger, higher income insurance buyers win, older, lower income lose. And does that make your plan more expensive? So, example, we have Ginger DeVault-Weimer. She asked on Facebook, just because we are, quote, older, does it mean we should have to be penalized with higher payments?
Well, I think in Ginger's case or anyone else's case, I would just encourage you to take a look at the bill that Speaker Paul Ryan introduced this week. It's widely available on the internet. Take a look at some of the analysis. I think you're going to see that while virtually every American has been losing under Obamacare, that Americans are going to start winning across the board when we give people more choices. By allowing people, as we will at the end of this process, I mean, this bill is the beginning. We'll do changes in our regulations. We'll do more legislation. But at the end of the process, allowing Americans to buy health insurance across state lines is going to lower the cost of health insurance for every American. And for our most vulnerable citizens, people that rely on the Medicaid program, we give states like yours greater flexibility to design those programs around their unique needs. So I just encourage Ginger and others to take a look at this bill. I think they're going to see that it is not only an improvement, but it takes us back in the right direction of an American healthcare economy built on consumer choice and the ability to choose your own doctor, choose your own plan, and watch those costs come down.
When you say choose your own plan, does your plan guarantee the pre-existing condition requirement, or will they have to pay more for that?
It was something President Trump made very clear early on, that there were a couple elements that had been passed by Congress 6 years ago that he wanted to retain. Making sure that people with pre-existing conditions have access to coverage, and also making sure that families, frankly like mine, are able to allow their kids to stay on their health insurance plan until they're 26 years of age. Those are in this bill. We'll continue those forward. So we're keeping some elements that the American people have placed value on. But when you look at Obamacare in totality, you see this whole idea of mandating that every American buy health insurance, whether they want it or not.
Why not have people?
Or taxing them if they fail to do that is the wrong idea.
But why not have
more
people?
More choice, more competition, lower cost is always the better approach in America.
Why not have people buy health insurance? Doesn't everyone benefit from that?
Everyone does, but I honestly believe that it was never right. I was actually a member of Congress at the time. It was never a right to solve the problem of the cost of health insurance by literally using the power of the federal government to order Americans to buy health insurance. What we ought to do rather, and we are doing in this legislation, is lower the cost of health insurance so employers and individuals will have greater ability to purchase health insurance. We're also including in this bill tax credits for Americans to help them be able to afford health insurance for themselves and for their families. So there's an awful lot about this bill, and I encourage your viewers to take a careful look at it. We're early in the legislative process, but I think when people take a look at it, they're going to see that not only are we repealing the failed policy of Obamacare, but we're setting our nation back on a course that's going to benefit the health of the American people and the health of our economy by lowering the cost of health care in this country.
So much to talk about. Wish we had more time, but we do appreciate your time, Mr. Vice President.
Thank you very much.